So nationally speaking, Black women, or in California, Black women die 3 to 4 times the rate of a white woman within the year of giving birth. And then in New York, that's 12 times. And we've looked at all the different aspects of why that can happen. And a lot points at the treatment and care and the lack of access to care in a timely fashion, which accounts for 60% of those cases. And so we know that racism it attributes to that. And so when we have that occurring, and then the harm that policing causes to Black families on different spectrums, whether a person be sleeping or walking with some Skittles or trying to have a baby. We have active genocide of Black humans in the United States currently. And so that's a lot of stress to carry as an individual. And personally, I have a traumatizing history with law enforcement from a very young age. And so to continuously walk into spaces where I'm already challenged to carry out the work that's essential that I do carry out as the only Black identifying healthcare provider at the General that is a midwife, and provides prenatal care predominantly to Black families. It feels like a battle that's too large for one individual or a few individuals to take on. And so for me personally, when I experienced that situation, I was no longer working. I was a community member walking out of work. And all of that happened. And if I'm a healthcare provider in a privileged position to, and still felt unsafe, I just think about all my patients or the other people accessing healthcare that are in different positions, how unsafe it can be for them. For example, those who are undocumented. I've had several patients who report that their family members didn't come in because there was law enforcement at the door. And nationally speaking, lawyers have brought this case up around fear of accessing healthcare or not accessing healthcare at all because of law enforcement within hospital institutions. So all of that put together, basically for me, my action was a 6 strike. So I am not going into work every time I have a shift. And that is a self-care act that I needed to take. Additionally, I've been joining other community members in actions. For example, a lot of the police brutality going on here in San Francisco demands that we do come together. And so I've been working with community organizers in supporting those efforts and joining community public spaces to give voice to counteract the policing harm. Additionally, in the hospital setting, there's the DPH Must Divest Coalition, which is a group of healthcare providers and community members and experts that have looked at the current policy and alternatives to sheriffs, and are also calling for removal of the sheriffs. And they've hosted some forums, including one coming up on the 9th, to get community input, get healthcare provider input, and seek out viable options that don't include police in our hospital system. I hope that answers your